HHC, as some would say. In this capacity, Ms. Brown directed strategic planning efforts, formulated and executed legislative initiatives and advocacy strategies. She also spearheaded a variety of initiatives, including implementation of comprehensive psychiatric emergency programs at several hospitals, the development of a community-governed community health center on Staten Island, negotiations with state and federal officials for the development of a new long-term care hospital and nursing facility in Harlem, as well as the development of hundreds of affordable and accessible apartments for the public hospital system, long-term care, and hospital patients. Ms. Brown is past chairperson of the National Association of Public Hospitals and Health Systems. Ms. Brown has also served as a member of the New York State Governor Andrew Cuomo's Healthcare Transition Team and Medicaid Redesign Teams. She currently serves on the board of the New York State Health Foundation. Ms. Brown graduated summa cum laude from the University of Pennsylvania, received her graduate training at the University of Pennsylvania Fels Center for Government Policy, and she is also the recipient of several awards, including the Marshall C. England Memorial Public Health Award in 2010. Where's Judy? Rosemary Foster Award in 2011, and mentioned in the Congressional Record for her outstanding work as a leader in the healthcare sector. Ms. Brown has been named the Modern Healthcare as one of the top 25 women in the healthcare industry. And is, again, I want to thank the board, Ruth Brown, members of the board, and those members of the community who participated in the search committee process for having this great opportunity to have Ruth Brown, Lorraine Brown. We got two. These two Browns. Is that what happened? Lorraine Brown is the new CEO for Interfaith Medical Center.
All right.
Thank you very much, Roger. And thank all of you, and I especially thank the ladies. Because, as was said, 8 women in particular who are strong and perseverant and willing to go the extra mile are worth 8,000 folks who are just tepid in their belief. And I also, of course, want to thank my board for getting me into this. And I say that really with an open heart. It was hard to leave my prior job because even as things are challenging, you can be comfortable in those challenges, right? In what you know, in who you know, and in the many, many, many people over the 30 years that I worked for the public hospital system, with whom I've had battles, but with whom I've learned to love and to respect. So it was hard to move on. But I think in one of my interviews, someone asked me why, and I said it's time. That it's time to move, it's time to give in a different way. My son said to me, I thought you were retiring. He said, you're jumping out of the fire, out of the frying pan into the fire. Why? And I said to him, because when I look at the needs of the community served by the Interfaith Medical Center, when I look at the faces of the people who serve Interfaith Medical Center, when I look at the folks who have been in this struggle, I see the community that I grew up in. I see my family, because I was the first person to graduate from college in my family. I see a struggle that we cannot rest on. I see the opportunity, if only in a little way, to do good, to do better for my folks, for my people, for all of us.
Praise God.
So I jumped in. And actually, today is the last day of my 4th week. So what I can tell you for sure is that I really don't know very much, but I'm learning. And I'm learning from folks who know a lot. And not because they have lots of degrees or things behind their names. They know a lot because they've been in the struggle, because they stayed. Because they've stayed and they're committed to this medical center. And I don't want to say this institution. I want to say this medical center because I don't want to say this hospital. Because one of the things that I want to make sure that I imbue upon everyone who's committed to transforming Interfaith is that they're committed to not only transforming what happens in this building, but what happens at Bishop Walker, what happens at this small dental clinic that we have on Bedford off of Eastern Parkway, what happens on Bergen Street where we serve 450 individuals who get methadone maintenance treatment, where we serve individuals who have HIV and who need primary care. And I want to do more of that. I want to do more in the community. I want this institution, this medical center, to be seen as a resource for the community. And not that people have to come here, but because we're out there. Now, I can tell you, someone said there are lots of challenges. Believe me, there are challenges that you don't even know about. But I'm starting to talk about them. Some of you are witness that, the first time I see you, I say, do you know? Here's the list. And there's some things that we just need to do on the short term. Because sometimes, if your roof is falling down, you can talk about renovating the house.
Come on now.
If you don't have any heat, and I mean that literally, if you don't have any heat, you can't talk, or if the folks don't have any heat, you can't tell them that it's going to be a better place. If we aren't providing a therapeutic, a respectful environment for our psychiatric patients, then we can't go out to the community and say, come on in. We have to do better, as our demographic would say. But we can't do better by ourselves. And that's why my heart is big today, because I see all of you, and we will continue to do what we need to do together. So there are a couple of things, however, that I'd like to talk about that we need help in. Someone said the clouds are looming. I'm sure some of you have seen various articles about a large system and the plans for Brooklyn, and I know our legislators will hear more about the big plan for Brooklyn. Now, there are some things that are inevitable in healthcare. Last night, just to share, I went to a meeting where Donna Shalala was the speaker. And many of us said, if we do have a woman in the White House, because Donna Shalala, Secretary Donna Shalala, is now the president of the Clinton Global Foundation. But of course, she was the Secretary of Health and Human Services. And she is very much, and has always been, and she also used to be the president of Hunter College. She has a very long and deep roots in New York, long and deep roots in healthcare. So there were a lot of questions about the future of healthcare. There were a lot of questions about, well, if the certain person gets into the White House, what would that person do in terms of healthcare? And you know what was really surprising to me? Because Donna has big ideas. She has always had big ideas. You know what she said? Presidents really don't really address some of these issues that you all are asking about. Like I asked about, small community hospitals, and they're surviving, and the need for resources. Presidents don't usually deal with that. And in this country, unless there are changes in both houses as well as the White House, a lot of the domestic issues that we are all concerned about, a lot of the social justice issues that we are all concerned about, frankly, may not